I'm Kenga Adinayi, and I'm a business analyst within Transformation Directorate. I will be sharing about the digital specification development for BSW's virtual wards program. BSW had commissioned SCW earlier in the year, in January to be precise, to support them with the development of their digital spec for as a precursor for the procurement of the solution for their virtual wards program. That's the remote monitoring technology for their virtual wards. I led the delivery of this particular project, and I also worked alongside the assignment manager for the delivery, Maxine Bowen Hall, and the project support officer for this delivery as well, Ellie Heaven. So one of the first things I did was to understand the landscape of BSW's virtual wards. BSW has 3 different virtual ward localities, one in Beams, the second in Swindon, and the third in Wiltshire. It was important to understand the requirements across these 3 different localities and to have that documented. So I worked with them, both the clinical and non-clinical stakeholders, to be able to achieve that. Also, the BSW had highlighted that the 3 clinical pathways in focus are acute respiratory infection, heart failure, and frailty. So it was important to also understand the requirements that pertains to those 3 priority pathways. So working with their different stakeholder groups, I was able to, develop and generate the requirement list for their different localities and consolidated the requirements for the BSW's virtual wards. It was important as well to prioritize the requirements. So using the Moscow prioritization method to get the mandatory elements of the requirement and the optional requirements. So we had the must-have requirement, the should-have requirements, and the could-have requirements. I worked with the Chief Clinical Information Officer in BSW and the virtual ward operating leads to be able to come up with a prioritized list of the requirements. Other aspects of the delivery included a soft market testing, which was deployment of a questionnaire focusing on the mandatory elements of the requirements to understand the art of the possible, the market capabilities. So working with our procurement team to ensure that the survey is phrased correctly and in alignment with procurement process and standards, we were able to deploy the questionnaire to suppliers, and their responses was used to refine the requirements further. Other deliverables for this particular work package included the development of a process map that shows how patients would be admitted from the point of referral to the virtual wards to their discharge from the virtual wards, and how the remote monitoring technology will support them. Also, the customer was keen for us to have like a scenario documentation for the step-up and step-down models of care. So I supported them with the development of a scenario document for step-up and step-down, step-up being referral by the GPs to the virtual ward, and step-down referral from the hospital to the virtual ward. We also developed a benefits realization plan for the customer that will be used for their benefits measurement and realization at implementation. This particular delivery is a very interesting one, as it brings together the mix of the consultancy and SCLA working model of SCW, and it has helped us to deliver great value to the customer, who has been so delighted with the way we approached this particular delivery, bringing the expertise of our procurement colleagues alongside the transformation team to provide this delivery. We've progressed into the procurement phase, but we wouldn't have been able to achieve that without the success of this development of the digital specification. If you have any questions about this particular project, please be in touch and I will be happy to answer any of your questions. Thank you.